Veterinary and medical importance of Oestrus ovis or nasal bird fly. First, I will talk about the pathogenic significance in sheep. Remember that sheep is more commonly affected by Oestrus ovis and goats are affected by it rarely. Due to the fly attack, sheep lose valuable grazing time, leading to poor weight gain and poor production in terms of wool, milk, and meat. Affected sheep become restless, shake their heads, and push the nostril to each other's fleece or grass or against the ground or any fixed objects, trying to escape the attention of the flies and the irritation produced by the larval stages. Mucopurulent discharge, sneezing, snoring, respiration are resulted due to the larval irritation on the nasal mucosa. Erosion of the bones in the sinuses, even penetration of the brain by the larvae, leading to produce nervous signs such as high stepping gait and incoordination, referred as false gait. If larvae die in the nasal sinuses or in the brain, there will be secondary bacterial infection which may lead to death of the affected sheep. Medical importance of Oestrus ovis or nasal bird fly infestation. Oestrus ovis or nasal bird fly may occasionally occur in dog and human. In this case, larvae do not complete their developmental cycle. Larvae deposited near the eyes causes catarrhal conjunctivitis, and larvae deposited around the lips may result stomatitis in human.